Hi, can folks hear me? I think I'm the one who has audio right now. We are waiting for a couple of panelists to come on. The no audio is purposeful, just so that it's not a melee in here before we start. So if you can just give us a couple of minutes, I will also put this in the chat for folks who are coming on. We're just hanging out for a couple of people. While we're waiting for folks, can we do a quick one-word check-in? How are folks feeling right now? Just one word in the chat, like, anxious, like insomnia, tired. Yeah, uh-huh. I'm seeing exhausted, overload, anxious, worried, sick, stressed, bored. Yes, uh-huh. All the feelings, all the feelings. Someone said all of the above, all of the feelings, worried about the elderly, but feeling community, energized by people taking leadership. We're just going to get started in just a couple minutes. Just waiting for folks to join. Alexandra said, grateful for this community and all the other communities coming together. Lots of people still joining, almost triple what it was when we got on. I think people will continue to join. We're 2 minutes into 2 o'clock, the 2 o'clock hour. Folks are still commenting. We're doing a one-word check-in about where we're at. We're the last few that we see are grateful, desiring community, grateful for holding the space, feeling a lot for the healthcare workers, eager to be helpful, stressed but looking for information, wanting to help but not sure how, curious, all types of things. Can everyone still hear okay? Yes. Yep. Okay. Someone had asked if the volume had cut, so I was just wondering. All the yeses. And thank you from Linda, who says I'm doing great with filler as we're waiting for folks to get on. Where are folks from? Where are your cities? Can you put that in the tweet. I'm located right now. My physical person is in Brooklyn, but I'm from Milwaukee and my heart's always there. Woo, woo. Los Angeles, Nashville, Columbus, Boston, Missoula. It's going so fast. New York, Austin, Anaheim, Brooklyn, Massachusetts, Indianapolis. All over is the Cliff Notes version of where we have people from. Still have folks joining as well. Another Milwaukee, yes, come through. So we've got some folks on here just seeing it whip by who are in, you know, places that are heavily affected. So we know that that is going to be something that we are really anxious to hear AFT's, you know, perspective on. Really excited to hear Randi Weingarten's perspective on, one of the foremost union leaders and feminist leaders in the country. Very excited to hear, you know, some words of wisdom in this time and this moment when we're really thinking about this crisis, which feels a lot, like a lot, but it's also practice for how we're going to be together moving forward as we're facing a very uncertain future. So I think that we have most of the folks that we're waiting for now, just waiting for confirmation from the team. So the last thing I'll say is kind of the first thing in setting up the call, which is my name is Rachel O'Leary. I am the Chief Operating Officer for Women's March, also the MC for the day, and our chief um, our chief time taker here as we're waiting for folks to get settled. We're here today to begin a series of conversations that we want to have. This is a first step in a series of steps that we're going to have to do with our new normal post, you know, coronavirus, as we're really thinking about how we're going to be together. So I have a couple of pieces of information that we have just about how we're going to manage this time together, and then just a couple of words before we get to our esteemed panel, who I will tell you about right now. Randi Weingarten is joining us, and she is the president of the American Federation of Teachers. Also from her team is Kelly Trautner, director of AFT Nurses and Health Professionals. We have two Kellys on, so I'll be calling them by full names. Kelly Booz, the executive director of ShareMyLesson.com, and Tor Cowan, the director of AFT Government Relations. And each one of them will be speaking to you on different kind of topics as we go through the webinar. And so what that's going to look like is we've got an hour together, just going to say a couple of words to welcome everybody, and you know, kind of have a panel discussion where we're going to have some questions, and then close that out, and then we'll move to we'll have a panel and then move to Q&A, and then close out there. And before I even move any farther, I'll say that we're going to be putting all of the resources and all the things that we're referring to both in the chat, which everyone should have access to, and we're also going to follow up on an email. For those of you some of you may be calling in on phones, so don't worry about the chat. Know that you're going to get the email. And there is a function at the bottom of your screen, should say participants, and then Q&A. If you have questions for the panelists, please put them in Q&A versus the chat, because the chat, as you see, moves very fast, and it's just kind of wild in there. And so we prefer to be in a little bit more of a structured environment with the Q&A, and that's from where we will be pulling the questions that we put to the panelists. Since everyone is muted, I'm taking the silence as acquiescence and moving on and saying just a couple of words from the Women's March perspective. First is that, you know, things are changing every day, and we are all working to kind of keep our feet under us and to get our read of this moment in our history. And given the existing and increasing threat of the coronavirus, Women's March really understands that a lot of women in our constituency, we're hearing from a lot of women in our constituency, and we're feeling ourselves overwhelmed, isolated. We're not necessarily sure what to do for tools and support. And so we thought that the best way to move forward for that is just to begin talking to each other and listening to each other, which is always, you know, really being in community and really being in support always begins with listening. And so we thought we would start there. So because we are, we have a Women's March has a very large base, and we have a lot of different activists in those base. Some folks are new, some folks are more seasoned. Some partners that we have are newer organizations like us that launched in the last few years. Some are much more established, like our partners who are on the call with us right now. And so for us, what we know is that um, our community already has the knowledge of how to get through difficult times, and particularly women know how to get through difficult times and supporting each other. And so what we're trying to do now is lift out that knowledge from the community and from the folks that we're already in constant contact with, and just kind of organize it and put it on a table in the way that's accessible to folks. And so we are first really thinking about what this conversation looks like and listening, but there are a few things that we know for sure. And that's that women are going to be on the front lines of this pandemic in many ways. We do the majority of caretaking for the sick, the vulnerable, the old, the young. We are at risk ourselves. We also make up the majority of the workforce in many of the industries on the front lines right now. New York Times says that flight attendants and nurses are two of the foremost impacted workforces. And we know that we can organize for basic humanity and fairness, and for the protection of our homes, for our families, for our jobs, and for our future, without sacrificing our principles or any communities. And we also know that there are oncoming crises that we've known about for a long time that are still coming. There's a climate crisis, thinking about how we get through coronavirus, thinking about how we get through different challenges that our communities will face. This is a dress rehearsal. We can figure out how to be with each other and how to create community and how to create mutual support in this moment, and create the capacity for moments to come. So how we're thinking about our role and what we can offer is continued education and connected webinars like these, other spaces. We actually have another webinar tomorrow about how to talk to your to kids around coronavirus, and we will have that information in our follow-up. How to mobilize our network to hold corporations, elected leaders, to move legislative action and electoral action on these issues. And also how to support and coordinate local efforts, thinking about virtual meetups, supporting local folks and self-organizing. So I just want us to all take a breath. There was a lot of people feeling anxious, a lot of people feeling worried and nervous. And it's okay to feel those feelings. And, we are here today to kind of get some direction on how we begin taking one step in front of the other, one foot in front of the other. So let's all take a breath. And let's move on to our esteemed panel, beginning with Randi Weingarten, again, the president of AFT, who's going to talk to us about the larger picture of what's happening in the country, the role of frontline workers, the impact, and any information. What's important for us to know? What do we need to clear up?
Thank you, Rachel. Can you hear me?
I can.
Good. So I'm in a car because I'm on my way to MSNBC, but I was not going to miss this in any way, form, or manner. First off, I just want to say thank you to everyone who's on the phone. And somebody says it's hard to hear me. Is it okay or no? I have my...
I can hear.
Okay, I just want to make sure. Is that better?
And the chat is saying folks can hear.
Mm-hmm. Okay, fantastic. Thank you. I just wanted to make sure. So I'm getting all the, it's fine, it's good, it's great. But this is also, thank God for technology, because technology will keep us connected in this kind of virus. Now, we have been, look, the AFT represents 1.7 million people. We're the second largest teachers union, we're the second largest nurse union, we're the largest higher ed union. So, and we are a pretty large public service union. So since the beginning of January, we've been watching what happened in China. We actually initially saw people coming back from China for, the Chinese New Year. There was a bunch of, profiling. If somebody was Asian, did they come back from China? So we've been, frankly, fighting against profiling, fighting against panicking, but fighting also to have people prepare since the beginning of January. So a couple of things that everybody knows already, but I just want to get it out of the way. We always have to have, you know, whatever kind of sanitizer, whatever kind of wipes, washing our hands often, sneezing into our, you know, into our shoulders or into our elbows instead of into our hands, washing off door handles, not going, you know, beforehand, not going anywhere if one was sick. We are now at a different level because the virus is in the United States, because there's no vaccine. There's going to be a lot of social disruption that no one has ever imagined. We have never been through. So the second thing I want to say is a little gratitude to each other and a little grace to each other is really, really important, because nobody's been through this. And if we don't actually have each other's back to try to figure out how to help each other, how to work with each other, how to virtually hug each other. And it's not just our kids, and it's not just our, you know, adult infirm parents, it's all of us. There's a lot of anxiety and a lot of fear. Number three, in a moment like this, the public health people tell us more than anything else, clear, consistent, honest, accurate information is the most important thing. And, you know, whereas I am really angry at the administration, I'm not using my time to talk about that. I want to talk about clear, consistent, concise information and accurate. And so of all the people nationally who we should be listening to, Dr. Fauci from the CDC, from infectious disease, he's been there for a long time. He has evidently finally been able to speak freely. And he is somebody that, for example, I really, really, really listen to. The others are, I would say that my governor, Governor Andrew Cuomo, is doing a really good job. Governor Inslee from Washington State is doing a really good job. And there will be others that are as well. But like, so I will stop in the middle of the day when I see Governor Cuomo on TV, and I'll just stop to listen to what the next things are. Big issues, big areas, and then I'll drill down a little bit, and then our panel will drill down a lot of it. The three biggest areas that we are focused on is number one, the health and safety of our kids, our parents, our families, and our communities. That's number one. Number two is the health and safety of those frontline providers, the people who are going to, and you're going to start seeing slides as I speak, the people who are actually going to be there when there is a surge in terms of hospitalization, when people are really, really sick. Those people, we need to keep them healthy, and we need to keep their kids healthy, and we need to make sure they can get to and from work. Whether it is people who are driving the subways, subway conductors, or whether it is a frontline respiratory, the doctors, the nurses, they are our heroes. And number three, we have to make sure, and somebody just said Governor DeWine in Ohio is doing a good job. I agree with that as well. We have to make sure that the short-term and the long-term economic impacts get dealt with. And so short-term, from what Pelosi just did in the House of Representatives, pushing McConnell to do it today, it was good that Mnuchin, the Trump administration, Pelosi got to a deal. Yes, it needs to be more and more and more, but those short-term effects. So let me just talk about a few of these, and then I know my team will do more of it. In terms of the health and safety of all Americans, inevitable, it will be inevitable that schools get closed. What we can see is from the CDC guidance, we know if CDC is telling us that there should be social distancing and that there shouldn't be more than 50 people at any one gathering, a classroom is 30 kids or more. And given that there's not enough access, there's not enough access of tests and things like that, then we just don't know who is carrying and who isn't. And that's why schools inevitably have to be closed. But we still need to make sure kids get fed. We need to make sure we are protecting those who are vulnerable. We need to make sure we have childcare for the kids whose parents are essential workers, and we need to make sure that we get online right and deal with the distance, the digital equity. And so that's why we're calling for the states that haven't closed. 33 states have closed, but for the states that haven't, we have to plan now. Plan, assume it's inevitable, and plan now. In terms of frontline workers, we are doing everything we can to get them the materials they need, the protection they need, including making sure the hospitals have the materials and the protections they need. That starts with N95 masks, but it goes on to things like ventilators and respirators and things like that, and canceling elective surgery. And we're working on that. In fact, in Ohio, in Oregon, and in Washington State, they're doing a really, really great job. And the last thing I'll say before I hand it over to people, to our amazing staff who will drill down on all of these things, is that short-term and long-term economic buffer is really important. So many of our families work paycheck to paycheck. We have to make sure that unemployment insurance is enhanced. So if people are laid off, they have some funding. We have to make sure that there's emergency sick leave. All of this is in that first bill. We have to make sure that, or in the family's first bill that Speaker Pelosi passed on Friday, we have to make sure that there's things like testing is for free, treatment is for free. So there's a lot of things that we have to make sure that families come first. I know that the president is worried about Wall Street. I'm not saying that Wall Street is unimportant. I'm not saying that banks are unimportant. Of course they are, but we have to worry about families. And then there has to be a big, big stimulus to get people back together. But for right now, we're going to see the huge kind of impact of social disruption on our lives because there's no vaccine, and we know that the transmission is highly contagious. We need to make sure that we're washing our hands. We need to make sure that we're not kissing and hugging each other, that there is some distance, and we need to make sure we stay home with our friends or with our families, and we do this stuff in terms of as calmly and as anxiety-free as possible. So with that, let me pass it on to Kelly Trautner, who will talk about a mitigation and healthcare strategy, and pass it on to Kelly Booz after that. And I just want to say again, Rachel, it's so great that you're doing this and the Women's March is doing this. But remember, health and safety of our communities, health and safety of our frontline providers, and then working on the economic impacts. Your voice matters. Talking to, petitioning, whatever, our elected officials has actually helped change the trajectory and the projection of this so that the care of our families comes first before anything else. Thank you very, very much.
Thanks, Randi. I think I speak for our whole team when I say what an honor it is to be working for such a powerful labor leader and someone who's definitely on the cutting edge from the very beginning of what has now become a pandemic. There is a lot moving at the federal level right now, a lot of disruption, as Randi said, in our communities, and even more moving on the ground in healthcare facilities, which is what I'll touch on. The long and short of it is that our system was not ready for this and is not ready for this. Systemic defunding of public health programming has really hindered our ability to handle the situation. And the disjoinder that is a consequence really of a consolidated, corporatized healthcare system in our country has really made the coordination with public health and government officials somewhat challenging too in a lot of communities. The governors and local officials in the states have really been left holding the bag in the absence of leadership that we've seen at the federal level. Randi mentioned Governor Inslee in Washington State, and I will say that the governor in Washington State and the public health officials there have been working incredibly close with our affiliate, the Washington State Nurses Association, and the other unions there who've been really coordinating and just a leading voice for patient safety, healthcare, the safety of healthcare workers, and frontline first responders. In Minnesota yesterday, the state announced closure of schools, and also that efforts are underway to use the schools as child care centers for healthcare workers and safety forces that we're so critically in need of on the front lines. The challenges related to lack of testing and other sorts of hindrances of disease surveillance and other public health response are many. This pandemic will also have an impact, we know, in looking at what's happened in Italy and other places, on the healthcare workforce supply that we are so critically going to need in the weeks ahead. This has a disparate impact in communities of color, in rural communities, on people with disabilities, and really in anywhere where there is a high Medicaid or uninsured patient population. Disproportionately, for example, seniors rely on Medicaid for the care that they need. And these sorts of factors really, I just want to say, make protection of the ACA so very important. On the issue of drug prices, we know that at least 3 in 10 people say that they've not taken meds as prescribed due to cost, and that's before the current situation that we're in. So one of the things that we really want to focus on is that it is so important that a vaccine and the development of any therapeutic drugs that might be used in prevention and treatment of COVID-19 is really important. It's really important that that everyone has access to those medications. We don't have enough ICU beds in the country to support the possible surge of patients that could happen. There are special types of rooms that are needed to care for those patients related to how air pressure is, how the airflow works. They're called negative pressure rooms. There's particular equipment that is needed, and we aren't ready. For example, in the case of an ICU, so ventilators that help patients continue to breathe, there aren't enough of those in the country, and there are ventilators in the federal stockpile, but still not enough for the need that we'll be having. We know that hospitals are setting up tent units and doing rapid response drills right now. One of the most predominant issues that's been discussed with respect to healthcare workers is a shortage in supply of respiratory protection that healthcare workers need. We've known since the beginning of February that there was a critical shortage worldwide, and we're still talking about where's the push for manufacturing. But we know there aren't going to be enough masks. Last week, the CDC weakened their guidance on respiratory protection for healthcare workers. Interestingly, the reasoning for the guidance was linked not to the needs of healthcare workers and keeping them safe and conducting the very critical work that they're doing, but it was based on supply. So, needless to say, we're incredibly disappointed about that turn of events. Our union, along with a few other unions, actually spoke with the CDC's infectious disease group when they were drafting this guidance. So we were pretty dismayed to see that the guidance was really based on supply and not science. OSHA has issued some interim guidance saying that they are planning to do a little bit of enforcement work, and there is a little bit of promise in at least the text of the guidance. In reality, though, we know from representing workers that OSHA does not have anywhere near the capacity needed to come in and audit. The process is too cumbersome and takes a long time, so we need action now. So our health and safety team is pivoting to focus on other things that employers need to do to ameliorate the risks of exposure for healthcare workers when they're on the job. These things are also things that would be really important for patients to think of, and they're things that really minimize risk through patients being educated, calling ahead before you go to the doctor's office, if you have an elective procedure, really evaluating whether you need that sort of thing or not. In healthcare facilities, making sure that there are adequate screening and isolation protocol in place. So we have special guidance that went out to our healthcare leaders over the past few days. It's also on our website, and I think everyone on this webinar could probably benefit from looking at the guidance that we've put together for all the constituencies across our union. And that is at www.aft.org //coronavirus. So you can see everything that we've been putting up. We have a lot of community focused materials that will be really helpful. But, you know, I just want to say, you know, I was on a call last night with our healthcare folks, some of our healthcare folks in the Pacific Northwest. And when we first started talking about this, the coronavirus in January with our leaders, they really, a lot of them kind of scoffed at this because, you know, we've had a pretty significant flu season this year, and it was the last thing they were worried about. And I just want to tell you that you know, the tone and the attitude of healthcare workers has changed exponentially. They're very concerned, and you know, anything that we can do to advocate for them to be safe on the job is definitely something that we need to do. We're doing everything that we can to advocate for our patients, for our communities, and those on the front lines. Whether it's respiratory protection or looking at the best levers on pay issues. So we have a lot of members, and there are a lot of people who aren't in unions right now who are grappling with what do they do if they're hourly workers and they're not, you know, they're furloughed or they're not on the job. So these are the types of things that we're focusing on. And as Randy said, our members are heroes, and we all, I think, every day are like hats off to our members because they're amazing. So thank you for having me, and I'm going to pass it on to Kelly Booz now.
Kelly Booz, we can't hear you. Can we actually move to Tor and then see if we can troubleshoot the audio issue with Kelly?
Yeah.
Oh, there you are.
Can you hear me?
Oh, we can. You're good.
Okay, great. Thank you so much. I switched the audio there. Okay, great. Let me go ahead and share my screen. And I was trying to share my screen periodically while everybody was talking. So thank you so much. And thank you, Kelly, Trautner, and Randy, who I think has had to hop off. They have really been incredible anchors and leaders as we're going through just completely uncharted territory and dealing with the coronavirus. So I run our AFT Share My Lesson website. That's sharemylesson.com. It is a free online resource site that is open for parents, for educators, for anybody. So you could right now go to sharemylesson.com and within 1 minute create a free account. And we've really been out in front of the coronavirus, you know, for several weeks now. And in fact, in January, we already had a collection of resources to start talking about prevention and protection plans for the coronavirus. One of the things that we ended up launching just this last week is another free resource on our site called our remote learning community preparing for the coronavirus, and that's sharemylesson.com/coronavirus/remote. This community of resources has a ton of content for both parents and educators, and that we are building content and adding content on a daily basis. It has a link to our original lesson planning resources on the coronavirus, with lots of content on not only the coronavirus, but history of pandemics, how you can talk about the coronavirus just even as kind of a current event topic with your students. It also has a lot of resources for parents specifically on ideas for at home. I have a 4 and a 7-year-old, and today is our first day of trying to simultaneously homeschool our children and full-time work at the home. And I can completely appreciate any of the other parents that are out there trying to juggle all of this, and all of us trying to juggle this completely new non-normal that we're going to have. So within this resource, we've got tons of collections broken down by grade and subject area. We're going to continue to add that to here with ideas of different things that you can do with your students at home and ideas for teachers as well. And one of the things that we're hearing a lot is also resources specifically to talk about mental health and, you know, trauma-informed practices and social emotional learning for stuff at home. I mean, my 4 and 7-year-old know exactly what the word coronavirus is, and they actually have a visual reaction when you say it So I know that it's, this is kind of a challenging time for all of us adults, but we need to also keep in mind what the challenges for our young people as well, from all age groups. So lots of different strategies there. I'm going to also just pop up and just show you, again, this is the website with lots of different content. Our site has always been open for pre-K through 12th grade. We're going to be adding some stuff for higher education that's coming up fairly soon. We've got tons of collection materials, not just on coronavirus. We've been known to have content for when we launched since 2012, and every kind of civic holiday, something current event. We have everything from PE resources, art, music, science, you name it, in every subject area. So when you come to the site, you can go again to the remote learning community, which is right on the homepage. And on this community, if you join the community, you have the ability to not only join it, but you can upload content and resources to the site, and you can see what other community members have been adding to the community itself. There's also a discussion thread for where people can engage. So I will be coming back to talk a little bit more about some of the other stuff that we're doing to help prepare educators who are now moving into this idea of distance learning and remote learning. If you haven't taught an online class, there are definitely some strategies that you should be using. And we have some webinars coming up with important strategies of how to teach online and how to engage online. We also will be launching a brand new resource on Share My Lesson today, and we'll be adding to it throughout probably the next few weeks, of really good free online content, both online classes that your students and kids can take, online tools for teachers to be able to connect directly with families and with students, from anything from Scholastic has just announced that they have right now 5 different classes online that are free for students to take. They're going to be adding 15 more. Zoom has announced that they've opened up their Zoom, which is what we're on right now, this tool. They've opened this up free for educators across the country to use as a way to connect with educators and with students. So we're putting together a full list of all this stuff. Now, I've seen tons of lists out there. I've solicited feedback from a lot of my friends. A lot of these lists are great. The trouble is that right now they're just a list of a bunch of links, so it's sometimes hard to see what is the list, what exactly is the tool, who's it for, what's the grade, what's the subject, how can it be useful for me as a parent, or how can it be useful for me as an educator to engage with students. So we're trying to put that together with some of the stuff that we think will be the most useful and most helpful. So if you have suggestions of things that you particularly like, I'd love it if you threw those ideas in the chat too, because I will take that back to our team as we're continuing to build out this page. All right, Tor, I'm going to throw this over to you now.
Hey, good afternoon, everybody, and thank you for this opportunity to talk to you all. I think everybody's probably pretty aware that the House passed the Family First Corona Response Act on Friday night. It was the culmination of, I don't know, a half dozen or 15 calls between the Speaker and Secretary Mnuchin. And even when they reached a deal, like at 5 or 6 o'clock, then we had to wait for the president to bless the deal in an actual tweet. And that's what kind of freed up the logjam at the end and allowed the bill to go forward. There's important stuff in this bill. It definitely takes some necessary and critical actions to help protect Americans' health and economic security. Definitely a vital step, but it's only a step. As Randy hinted on before, we're going to need a much more comprehensive and bold plan to stabilize the economy and make sure that people severely impacted by this, workers, people in communities, are dealt with. So you can go to the next slide, Kelly. I'm just going to quickly run through a couple of things that are in the bill. Free coronavirus testing for everybody. There's 14 days of sick leave, and also FMLA, Family Medical Leave Act coverage would allow people to go to 3 months if they need to be with family and take care of folks. I'm going to come back to that in one sec. There's also an enhanced and extended or expanded unemployment insurance provision. There's also stuff around food security. It's going to make sure that kids, adults, anybody that really is in need of food at this time is not going to go unfed. And there's some flexibility to make sure as schools close that kids are going to be able to go to get grab-and-go meals at designated spots. Finally, there's some increased payments to Medicaid increase payments to states for Medicaid, which is very important because states are now experiencing a bunch of costs they didn't plan for. And by increasing the federal match to states, that's going to help backfill and allow them to continue to perform services they do every day. I know that the paid leave has gotten some attention, that people are critical that it didn't cover enough people, and they're absolutely right. You can thank the president and the Republicans in Congress. They held very firm on they did not want to grant paid leave at all, and this is their compromise. I give the administrator, or I give Speaker Pelosi a lot of credit. She did not want to have a stalemate. She knows how important it is for people to get the security of knowing that they're going to get paid leave. And she decided to move forward with a plan that will definitely cover millions of people who would have no coverage at all if they did nothing. You can go to slide 3. So the Senate is supposed to vote on this perhaps tonight. I don't want to get into boring Senate procedure, but it would be really helpful if folks could call their senators and urge them to vote for this. I think that some number of Republicans, I can guess Rand Paul and maybe Mike Lee, will object to this bill coming up, which means it has to wait a couple days, which is really ridiculous given the needs and how quickly we need to move on this. So probably if it doesn't pass tonight, it'll take a few days, but I anticipate they'll do it. The bigger issue that we're going to be focused on is the pandemic is definitely going to cause an economic turndown. Everybody's starting to see this. And all the things we ticked off, we're going to need to continue those things and perhaps blow them up even further. We definitely need to make sure that paid leave is available to everybody that needs it, not just people who are in companies of 500 or less. It needs to be for everybody, because clearly that lets off people who work for CVS, McDonald's, and a lot of other large franchise. So we need to come back to that. Industry and the private sector are going to be lining up in the halls of Congress to get a bailout. No doubt about this. It's very important that as this happens, that we make sure, and we've got lots of friends on the Hill that are going to help us with this, make sure the public sector and the people they serve on a daily basis are not forgotten. We went through a lot of this in 2009 when we had the recession and the ARA bill. The Reinvestment Act was passed by Congress in the beginning of President Obama's first term. But that bill provided critical relief to states who were, of course, as people don't work or they cut down on hours or they don't earn as much, obviously state and local tax receipts go way down. And that results in diminished public services. So there's a very important role for Congress to play in this next bill. We need more in FMAP. We need a direct infusion of cash, whether it be through a state stabilization fund or through more money through existing education formulas like Title I and IDEA. At the same time, we need to make sure that individuals who maybe risk the chance of foreclosure or eviction, that there's a moratorium put on those things. And we're also looking into ways to relieve, if not eliminate, some student debt as part of this, because obviously that's been a drag on the economy and it will become an even bigger drag moving forward. Again, the number's up there. Please call your senators. It's vitally important we get this bill done quickly. And thank you all for your time. And I think any of us are happy to answer any questions.
Great. So we will move to Q&A now. As a reminder, if you have questions, put them in the Q&A box at the bottom of your screen or on that bar. So the first question that we have is, how are private daycare facilities regulated while other institutions are governed by government rules, for example, public schools? So anyone on our panel can just jump in on that.
Do you want to repeat the question?
Go ahead,
Sorry,
Tor.
Kelly.
No, you go.
Repeated, the question is, how are private daycare facilities regulated while other institutions are governed by government rules, for example, public schools?
I mean, I think Kelly can speak to this better than myself, but I think a lot of it has to do with what the state laws are. Obviously, if a program gets federal assistance, you know, in the form of Head Start or something like that, federal regulations will apply. But I think for the most part, that's something within the primacy of state and local governments.
Yeah, I mean, for the private daycares and stuff like that, they do have regulations that they have to meet, and they have to be approved by state guidelines and stuff. You know, a lot of what we're seeing with a lot of the private daycares right now is that they're following with the lead of what the school system is doing, or they're following close to the lead of what the school system is doing. So, for example, our school system is now closed down until April 13th. Our daycare, where my son's in pre-K right now, hasn't necessarily closed down for that length of time, but for at least the next 2 weeks, and we'll kind of circle back at that point. So I think that a lot of the daycares are either going to be forced by the state in whatever the state mandate says, or will follow what the local school division is doing.
And this is Michelle Ringett, also from AFT. I will just add that all over the country, we've been getting reports from people whose daycare is closing down. We know this will have impact on Head Start. What we are doing is making sure that in all of the emergency legislation that's being pushed through, that this is not a forgotten class, that we need to make sure that this happens, particularly for emergency personnel, because we need to be able to keep our healthcare providers, our pharmacists, our delivery people, like lots of people who you might not necessarily think as critical workers during this time. In order to actually keep people out of crisis, there are a lot of people who need to be designated. They have childcare needs. We need to make sure there's safe, high quality childcare and also clean facilities. So we also need to make sure that we are taking care of custodians, janitors, people who clean the environment, people who are doing deep cleans right now.
We have another question from Catherine. Is the general public now at risk? Not just you know, folks who were previously considered to be high risk, such as the elderly or immunocompromised folks?
So I'm not a clinical person, I'm not a scientist, but I'll tell you, just because I've been steeped in this for now a couple months. So obviously the people that we've been hearing about on the news, the elderly, the people with underlying chronic health conditions, those sorts of folks, they are definitely at higher risk. One of the things that Fauci has said is that just like with any other new sort of virus, that there will be surprise people that are kind of outliers. So a 23-year-old otherwise healthy person may become very ill and may, eventually end up, dying from this virus. That's not expected to be the norm. I think, beyond just the virus, the demand that is going to be placed on our healthcare system is going to present an access issue for people who need care for other reasons. So, for example, my dad is on a heart transplant list, and he is avoiding going to the hospitals and the doctors like the plague, no pun intended. And that is what they're saying is that's going to be across the board, that people who have possibly a broken limb or some other healthcare issue that would be somewhat routine to address, because of the access issues, there will probably be adverse outcomes because of that also.
We have so many good questions. Let's go to this one. Anonymous attendee asks, how can we ensure that we protect people and workers in an equitable manner? Right now, the airline industry has asked for more than $50 billion in relief, which is in excess of the Family First Act. What do folks have to say about that?
I can start. I just want to jump in. This is what I was kind of getting at before. This is why it's really important as Congress develops this third bill. We've had the emergency supplemental, we have the Family First Corona Response Act. Then they're going to have to do something to jolt the economy, and equity is really, really important here, because we saw what happened in 2008, 2009 with the bank bailouts, and we know how well those went. So it's going to be important that groups like you stay engaged and make sure that your representative and senators know that you think it's important that they pass a stimulus that really gets to the people who are doing the work, not just to the companies. Others can jump in. Michelle might want to.
Sorry, so we also work very closely with the Flight Attendants Union. We work with UFCW. We work with Unite Here. There are classes of workers all over the country who are on the front lines right now and are still facing significant layoffs. So a core piece of what we're doing is not only making sure that paid sick leave, and Tor, did you cover this? I'm sorry, I'm like multitasking, but on the paid sick leave piece, in making sure that we have to extend it to the large employers. One of the big problems with this, just on the gossipy side of things, is that in the conversations when they were trying to cut a deal to keep things moving, they didn't think it was necessarily that the Mnuchin and his team were being venal, although they are venal, and I don't mind being political about this, that it was ignorance and a lack of understanding about the world of work and about what people really face. So that gives you all something you can do right now, which is shining a very bright light on what working people across this country face in all different sectors, in all different fields, because too many of the people at the decision-making table have false beliefs that everyone has paid sick leave if they work for a big company, or like, of course the employers are going to take care of them, or oh, they'll just get unemployment. And they don't realize that right now we need cash in people's hands to purchase groceries, to get the medicines that they need in order to make sure they can provide direct care to their families and themselves. And
just to, for a little further on Michelle's point, we just found out about this today, that one of the things Republicans insisted on for these companies that are going to provide paid sick leave is that they now can get tax credits for that. That was not part of the original Democratic proposal. And it just so happens it's a little hard for a school district or other public sector / government agencies to use a tax credit. So that's something we're going to have to tackle in a technical corrections bill moving forward.
So we have 10 minutes left. I think we have some time to take a couple more questions and then look to wrap up. On the same topic of workers, there's a number of questions in the Q&A around gig workers. Many workers are not going to be covered by new legislation, and some of them are not covered by unemployment insurance or any of those things. So what do we have to say on that topic?
So I'll start, and then Tor, you bet clean up for me. So the service sector, the hospitality and travel industries, the gig economy, freelancers, there are entire groups of people right now who, some of them live paycheck to paycheck, some of them cannot even stretch a paycheck to cover their bills, and they are at great risk right now. So as we are pushing and lobbying on the Hill to get emergency benefits to families, we are recognizing and we have to name the individuals who will be disproportionately affected. It also shines a very bright light on some real vulnerabilities in our economy and how we structure our society. And we better make sure, as we are also planning the stimulus and how we come out of this, that we do not forget these individuals and the types of work that need better support systems put in place going forward.
No, Michelle, you got it perfect. It's definitely something that's going to be in our portfolio that we're going to push in this third bill, because that's a lot. There are a lot of people who obviously work in the gig economy, and they need to be taken care of.
Yep, and the one piece I would add on to that is the AFT is also the largest union inside the AFL-CIO. We work with our sisters and brothers all across the labor movement inside the AFL-CIO and outside to make sure that the weight of the labor movement, which is not, we don't have the density we once had, but we have the fierce urgency that we've always had, which I think many people have seen through the Red for Ed movement. We fight for all working people in this country, not just those who have union benefits, but they're probably, in the last couple of days alone, I have not seen a better argument for how unions can organize themselves and reach out to people all around the country very quickly, because for everything we're seeing on the news, for everything coming down from the White House, like what I'm finding is what people are coming to us with are questions and gratitude for the ways they can organize with one another through their workplaces.
We're going to do one last question, and I think it's an important one because it's something that has been weighing on folks' minds just from the original chat. The original questions is, the question is framed as students are getting used to this new normal, what are the good first steps to check in with students themselves around sensitive topics such as stress and anxiety? But I would actually expand that to how are we all dealing with stress and anxiety in this moment, and how are we taking care of ourselves? And just want to limit this to about a minute and a half so that we can wrap up and not be rushed.
Yeah, no, I'll jump in on that one. That is a really great question. I mean, I think first and foremost, with even your colleagues that you work with, I'll come to the students in a second, but I think it's important when you start a meeting on a daily basis is just to do a check-in and see how people are doing, not about work, but just about how are things getting structured. I think it's really important to acknowledge our new normal and figure out how we can make it work together. But also with the students, yes, I think that most immedately right now, especially for schools that are closed, and for schools where they're not set up right just yet for teachers to engage directly with their students. I think it's really important for the for the parents to take a look at some of our trauma-informed practice resources, our social emotional learning resources, and our mental health resources. There's a lot of great material on Share My Lesson on that coronavirus remote distance learning page that we have. And I think there's lots of good ideas by grade and subject and age appropriate material that you can have. And in addition, the resources that we'll be sharing out later today and over the course of this week of really good stuff that will be focused on social emotional learning for students. I think it's important to do a check-in, just like I recommended checking in with your colleagues, start doing check-ins with your kids and just see how they're doing, and acknowledge that, we are the adults. We're there to support, and we're there to support the kids. You have, you're not only your parents, but we've got teams of other adults that are always going to be there to take care of the kids, and just to reassure them that, we can't promise anything, but we can also just say that, if something does happen, we're there as an adult to support those kids. And Kelly, I don't know if you want to add anything from your perspective or not.
No, I think that if we can move forward, just keeping an eye on the time, we've got 5 minutes. Kelly, if you could just continue to begin our wrap up to give a little synopsis around the conference that's coming up.
Yeah, no, thank you. Let me quickly share my screen again. I'll pop this back up. So the timing of this was not by any means timed around the coronavirus. This is actually going to be our 8th year running a virtual conference. It is a 3-night virtual event. We have 42 different webinars that we are doing next week, March 24, 25, 26. We've been in the online webinar space for several years now. I've done at least well over 500 webinars myself, with an incredible team of Share My Lesson staff at the American Federation of Teachers, and even beyond that, because it takes an army behind the scenes to virtually launch this. So I think this is probably the one conference in the United States that we do not have to cancel right now, but it is a 3-night event. We have lots of different topics that we're covering, from just regular old, science and technology and social emotional learning. Those will be really great, and I think very helpful for both teachers and for parents right now to join some of these webinars, to strategies for teaching for all different grades and subject areas for teachers. We have now also just added this last week 2 new webinars that we're going to do in partnership with Facing History and ourselves, a great partner of ours, and PBS NewsHour on the coronavirus. One is going to be focusing really on just the maintaining the healthy schools, or I almost need to adjust this title now because it's not going to be maintaining healthy schools since most of us are going to be out of schools, but talking about what we need to do at home to still stay healthy. Kelly Trautner, my colleague on this webinar, will be joining us, and then we're bringing Facing History and ourselves to talk about strategies for online learning that will be good strategies for both parents and for teachers. And then the second is with Facing History and ourselves and PBS NewsHour, talking about just the complex topic around the coronavirus, with whether it's talking about racism and xenophobia, or just the current event itself of the coronavirus. So again, this is on our website. It's on our homepage with the link sharemyLesson.com/VC for virtual conference 2020. And each webinar is 1 hour long. And hopefully you will consider joining us for one or more of these, and they're all free. Thank you.
Thank you so much. And just as a reminder, again, the resources that we've been sharing are both in the chat and will be in the follow-up email that we send. And we are going to conduct a very quick poll right now on the computer. Folks will have about a minute to complete it. It's going to help us get a better sense of what you all are wanting and needing in this time. So again, we're thinking about how we're directing our time, and what do you want to hear more about? Resources for local work, taking action on legislative and electoral issues, or online opportunities for education and connection. So tell us a little bit about what you're thinking. And again, we're going to, while we wait for that to come in, we're just gonna continue to wrap up here. And I wanna say thank you to everybody for, particularly our panelists, for jumping on with very quick notice. And thank you to everyone who came on. We actually had a great turnout for a middle of the day webinar. And I just want to, just kind of go back to the fact of, I know it feels like a very easy first step to take, to be on a webinar of 300, 400 people, and to feel like, okay, so I was listening. But actually listening and learning and educating ourselves and then talking to people is a really big step in social movements. And when there have been times of crisis, we oftentimes hear about these big heroic acts that get, kind of lionized in the history books and all of those things. But actually it's the people who stuff envelopes. It's the people who organize, meal delivery services. It's the people who, organize, escorts and take back the night actions and things like that, that are really the people who own and drive the achievements that we make together as a movement. And this is absolutely scary, and it's absolutely overwhelming. And I just watched the Mr. Rogers documentary, so I'm looking for the helpers, and they're everywhere. So in this moment in time, we know that as a movement, and also for Women's March as a movement of women, we know that women have taken leadership in very similar situations, thinking of the role that women played in the AIDS epidemic, the role that women played in different times of crisis in our country. So while it seems overwhelming, and while it seems scary, and while it is those things, we also have the opportunity to come together as a community and really shine a light on the path that we have to walk as a country, away from this dark road that we've been on, to a different future, and one that is not, determined, where your success and your health is not determined by your gender, what job you do, or how much money that you make. So I really want to say thank you to everybody, all of our panelists and everybody who joined us today. We're at time, and we will be following up with resources very soon. Thank you so much. Oh, one more plug. Women's March has another digital opportunity called Digital Defenders. We haven't heard about that on this call so far, and we will be including some information there about how you can get involved with advocacy online while we're in this state of quarantine, so that you can continue to talk to people about the issues that matter to you and continue to make change. And thank you again to our colleagues from AFT. This webinar came together very quickly, as all of these things have come together very quickly. So thank you to everyone who's been helping us, and particularly Randi, who took this on the fly as she was in between a number of things. We thank you all so much for your partnership in your community, and we will be in touch soon. Thank you.